Good evening. Good evening. Welcome to the Coalition of Churches and Community USA broadcast today as we continue to advocate for equality, economics, and education. This is your virtual host for this evening, Reverend L.K. Floyd, President of the CCC. And tonight we're going to talk about some very important issues that are affecting the African American community in particular. And one of those areas is health. Listen, do me a favor if you will go to our website, cccusa2020.org. Go to cccusa2020.org and find out more about the Coalition of Churches and Community USA. And so, without further ado, we're going to invite our special guest to come forward and we're going to talk a little bit about things that are pertaining to health in the African American community. We thank our visitors for joining us with us today. We have Miss Candace Willett and also Miss Passion Smith. How you all doing tonight?
Doing good.
All right, great, awesome. And so tonight, as you know, we're going to be talking about health. Could you just tell us a little bit about yourself and who you are?
All right, my name is Passion Smith. I am 25 years old. I have a background in social work. I'm currently working on my doctoral degree in social work. When it comes to health, I am in the reproductive justice section. So I focus on like health disparities in the birth world.
Awesome. Also, Miss Willett, can you tell us a little bit about yourself?
Absolutely. Just a little bit about myself. I have worked in healthcare for a number of years, and also, as of right now, I'm in health policy, resiliency policy. I also am a doctoral candidate for health education and promotion with the emphasis in behavioral health and population health. I'm also a certified health education specialist, and I'm also a certified health coach as well. I also do research around health population, health disparities, and health equity. My main focus is social determinants of health.
Wow. My goodness, we have an excellent panel, excellent group to talk today about health in the Black community. So privileged and delighted to have you both on to share with us on our conversation concerning the Black community and health. As we looked at the idea of the Black community and health, one of the things I heard one of you share was the idea of the disparities in the Black community. Would you all just share with me some of the disparities you see on your radar within the African American community and context?
So I know for all health outcomes within the birth world, statistically, African American women are 3 to 4 times more likely to die, and this goes for women and infants compared to white women. So that right there, it speaks volumes. Many people think that it's contributed to like the things we eat, it's contributed to the activities that we may do, but statistically it shows that a lot of health professionals think that we don't experience pain. A lot of health professionals, they don't offer the same type of care to African American women because of their own biases, because of their own racism, their racist beliefs, and because they are just not really educated on the barriers that African American women just face by itself.
Wow. And so when you look at the disparities in health concern, you were talking particularly about women, but are there any disparities that you see that affect both women and men?
So even when it comes to postpartum care for like the community that I serve, I was just talking with someone today, an African American father, and he was talking about him not having the support that he needed, that him and his family needed once the baby got here. And so the disparities come in that most African American families, they don't have access to postpartum resources. Most of them are forced to go back to work early. Most of them don't have access to postpartum services, so like having that village, and so it affects the overall health of mom, dad, and just the family unit as a whole.
Ms. Willa, can you share with us some of your thoughts as relate to that question?
Absolutely. So When we talk about health disparities, we have to make sure that we back up for a moment, because within the social determinants of health, you bear health equity and health disparities, right? And so we want to make sure that when we're discussing health disparities, that we're discussing the reasons why those health disparities are. And so when you talk about the social determinants of health, which is the overarching theme and theory of why health disparities take place. So one thing is that social determinants of health actually impacts everyone and their health and their well-being. And so if we don't have those access to resources, for an example, in the Black community, we are more likely to have chronic diseases. We're more likely to be diagnosed with chronic diseases. We're more likely to not have access to healthcare. We're more prone to having or living in unhealthy environmental regions or areas of the city. We're also prone to being impoverished and not having the access to resources like education, transportation, produce, all those things that make it easier in your life, more healthier in your well-being. So we have like that one strike against us already when we're talking about health disparities. So when we're talking about health disparities, we're talking about health inequities, right? And so me have been in a hospital, working in certain communities that deal with healthcare and seeing how healthcare is being permeated through these communities, we're seeing that it's lack of resources. We're seeing that many African Americans do not understand healthcare or health policy for that matter. They do not understand or have the health literacy. Now, mind you, when we talk about health literacy, we're talking about understanding when you go to the doctor and the provider is not being upfront with you, or not being having that patient-centric care that many others do get. And so when we go into a doctor's office, we're not met where we are. So it is a great divide when we talk about health disparities. Even with a person that has social economic status, still have those health disparities. Even though you may be a middle class or upper class African American, you still have those health disparities. Even though you have the access to income, you have access to a healthy environment, you still have access to education, transportation. You live in another neighborhood that has access to all of these things that in the Black community we do not have access to. So we want to make sure that we understand the overarching reasons. And medical biases is very big. It goes back, it has a history, right? And so when we talk about that, we want to make sure that we are talking about the overarching. And so one office in particular that works on minority health in general is the Office of Minority Health through Health and Human Services. They put out a number of information, plethora of information that talks about, how can we as African Americans better our health, and how we navigate these waters when it comes to healthcare and also other things that affect our health, because it's 8 pillars of health. And sometimes we don't focus on all of those pillars of health. We only focus on some. And so we also have to be mindful that only 50% of African Americans take their health serious, right? And so we have to look at that number. And so if you take 10 people, only 5 of those people will take their health serious. So how do we reach those other individuals? And so just moving along, I just really want people to understand that it's more than just health disparities. It's the social determinants of health that we are actually addressing, and the health equity that we're addressing.
I like that idea of health equity and dealing with the social context of, because one of the things we deal with in many of the urbanized African American communities is there are many food deserts that are in the inner
Yes.
city. For example, in Southeast, you might in Washington D.C., and some people might who maybe listening in Philly. Some people who are listening, you're listening in the Bronx, New York, and some of you are listening in Columbia. But notice in the Bronx or in Southeast DC or in the urbanized areas of South Carolina and Columbia that the food deserts are there. When you look at it, there are Chinese stores. There are different Popeyes, and KFC
Yep.
and McDonald's on every corner, but you don't see Whole Food.
No.
That's
You don't
right.
see Trader Joe's. You don't see Mom's Organic. But when you go into other communities, you see Mom's Organic. You see Trader Joe's. You see Whole Food. And one of the things I think a lot of things we don't realize is a lot of it is in what we put in our body
Yeah.
that links to the sugar, the complex carbohydrates, the grease, the fat, all that stuff that, and then also I think one of the things that's important when we talk about this is exercise and also the awareness of health. Like, just
Absolutely.
being aware of what, like, when you know better, generally you try to do better. I mean, when we think about when I grew up, my mother is from deep south down in the country, and now, when we moved to Washington D.C., we didn't know that some certain things were not good for us until we began to learn and begin to integrate, understand more. But those are some of the things, the disparities. But why is a forum like this important for community to hear as they to the disparities and understanding what we're facing?
I think
I think it's important because some people don't realize that this is a real issue, and so I think that it's important to bring awareness and to try to educate the people on what's really happening and what's really going on. I hear a lot of people, even like in the birth world, and they'll say like, "My health is good," or "My birth went good," but then when I ask them like, to give me details, not so good. And so it's like our perception of what we view as healthy is almost different than what being healthy really is. And so forums like this just give people an opportunity to just be educated, because I don't know about where you all are, but I know even here, I'm in North Carolina, Goldsboro, North Carolina, a real small town, but there aren't many people talking about health and nutrition, especially within the African American community.
And that's why you're there.
You are right.
All
and
right.
and I will just like to add to that is that when it comes to our health, we have to make sure that being we're doing awareness events, but also doing prevention events, which are totally different, right? And so I think sometimes when it comes to the black community's health, we're always in that prevention stage. We're not in that awareness stage.
Right.
We're not, you know, we are actually, it's three types of prevention that we do. And so we're always in that secondary and that tertiary prevention stage, but we're not in the awareness stage. We're always in the prevention stage. And I think when it comes to awareness, talking about it is amazing, and doing events around it is amazing. But we also have to make sure that we are actually picking up the ball after the cameras are off, to make sure that we are all doing what we need to do to stay healthy, right? And so when you talk about certain things, or when you have a platform, make sure you use that platform for awareness. When it comes to prevention, we have to make sure that we are doing things that can benefit or talk to in layman's terms, right? So we have to make sure that we have documentation and literature around those awareness events. So for me, I'm always in the in the aware. And so I'm always trying to make sure that I am aware of, my health being, my health status,
Yes.
along with other things that may go on. And so we have to make sure that we are, not all, but only we have to make sure that we're giving factual information
Yes.
around our health. And also, a lot of African Americans in our community, even though some have moved away from religious stand beings, but they still have that religious being of moving or what they may use their religious base more so than medical base or
Yeah.
science.
Yeah.
They're more likely to believe in a religious belief or what we call natural remedies, more so than medical science. And I can understand why, but we have came such a long way from the Tuskegee study. We have came a long way from Henrietta Lacks. We have came a long way from that. We have a lot of people of representation that is trying to represent the health community around African Americans, but we also got to make sure that we're getting on their level. Even though we may have a seat at the table, we still have to make sure that we are bringing that information back and implementing it, and also integrating so all African Americans can feel included, especially when it comes to healthcare.
And I think that all the points that you made were very well stated and also impactful. Hope you all listening to what she's saying, that we need awareness. We don't just need prevention. We need to be in the front and not on the front end, not on the back end. But one of some of the basic things. So she's a professional in the area of healthcare. Go to the doctor. Let me keep it simple for you. Go to the doctor.
Yeah.
Yes,
People get
yes,
yourself, see you go get your oil change. Why don't you go to the doctor? Go take care of those things, and the basic needs. But it's so important when we have this type of conversation, because we have so much that is affecting. I want to tell you something, that the police are not the only thing killing black folk. Uh, I know you think that only the police is killing us, but I want to let you know economics is killing us.
yes.
When you look at health, is killing our health is killing us, and we'll march about those things. That's why the coalition is three: equality, yes; social justice reform, voter registration, police brutality, economics, yes; being able to economically understand the plight of what's going on, economic justice, but also education, to be able to educate our people on different issues. And one of those areas is healthcare. Now we have another guest that is going to join in with us, Sylvia Les. She's coming in with us. How you doing, Miss Sylvia?
I am fine, thank you. How are you guys doing today? Pleasure to meet
Doing
everybody.
good.
All right, all right. Thank you for joining in with us for this conversation on the Black community health. Could you just share with us, as you have come on to join this dynamic panel, a little bit about yourself, and can you share with us shortly your story?
Okay. I am a 30-year retired Verizon employee. I retired about 14 years ago to start my own business as a children's entertainer, and I have a premier event center here in Temple Hills that has it's a 10,000 square foot black-owned event center that has a big bounce house, and I have meeting rooms. A lot of people to birthday parties, churches rent the rooms for their fellowships and things like that. And my story starts though. My story starts really. I opened that in the midst of this COVID, and in the midst of going to the doctor and finding out that I had breast cancer, when
Wow.
breast cancer was nowhere in my lineage. Okay, and um, however, I tried to trace that back down no matter what. I was a telephone installer for 15 years at the Pentagon, putting on infrastructure. So I'm thinking, I don't know if that was a part of it or what, and I still don't know, which still puzzles me. But the main part I want to speak on is changing the narrative at our dinner tables and at events and with your families, about to your children and grandchildren, about it's okay to not be okay.
Mhm.
Meaning it took me the longest time to even admit to my family that I had cancer because I was always being that independent person, being strong. And then after that, it took me a long time to bring it up to I have a 17-year-old granddaughter, and I wanted to talk to her about getting checked up early, even though, there's no lineage, nothing that's in my family. I wanted my whole family to get checked up to be okay, because it's not just cancer doesn't just only affect your body; it affects your it's emotional, social, physical. It affected every single part of my body. Even today, I still operate in pain because of that word lymphedema. I have the lymphedema, the after effects from cancer surgery, which was over a year ago, February. So it's important that, and another thing that really perplexed me is once I came out and I admitted I had cancer, there were women that I sit at next to in church every Sunday that had cancer, and nobody ever knew about it.
Wow. Wow.
And that, if only somebody would have talked to me, shared with me, that I would have known. We always know you check your breasts and things like that, but there's other factors like losing weight. I lost 75 pounds
Wow.
from that time, and it's also when I went to the doctor, I didn't know the right questions to ask. Even after I had during the surgery, I didn't know that I would be tasked with having this lymphedema the rest of my life. I didn't know that I had to have special garments made for me so I won't be hurting. I knew that they would just talk about radiation. I didn't know. I went through radiation really good, and no scars until maybe 2 or 3 weeks, and my skin started peeling off. I didn't know all those things, but those are things that we need to talk to our people about that, so they'll understand. You're gonna have radiation. You might go through it good, but look on the back end what's going to happen. And that's why I felt compelled to say this today, is that there was so much that I could have and should have known to help me to be the best me I could be afterwards.
And one of the things she mentioned that was very important is it wasn't in her lineage. She didn't have any type of, generally you look down your lineage and you can pretty much see mama had diabetes.
Yep.
Chances are we on the same diet program. That's going, mama, daddy had high blood pressure. I had, and then down the line, but she said it wasn't in her lineage and she had it. But one of the things she also mentioned was obesity. And one of the things we're dealing with in our community is obesity. And a lot of us
Yes.
are not overweight. A lot of us are obese.
Yeah.
One of the things, even for me personally, I found myself in the hospital. And the reason why it's good to have different perspectives, because you hear the technical point of view from Mrs. Willett, you haven't hearing the working point of view from Mrs. Smith, and you hear the testimony from Miss Sylvia Lett. But the idea, I had acidic pneumonia, and my pneumonia was because acid was dripping in my lungs because of the food I was eating, and yet I was 30 years old in preparing to die. I was on my deathbed with a cavity in my lung the size of a baseball, with fluid in both sides of my lung, because of health concerns and health choices. So those are important to hear that kind of testimony. But let me say this. I want to ask a question. Um, what can we do on a grassroots level to push legislation? I'm gonna ask Miss Willett that, and then Miss Smith, and then after that Miss Willett, Mrs. Smith, and then Miss Willett. What can you do on a grassroots level to push for better health care legislation?
Okay, so
I know that's your area. That's your
this is my wheelhouse. Number one, individually, looking at the ecological model, right? We have to think about self, the people around us, the community, and then the actual community and the organization, right? And so what I will say is, number one, for self, make sure that you educate yourself. Educate. Google is at our fingertips. All the information you need is on Google, right? And if Google don't know it, then go to somebody that does know it. There's plenty of information out there for you to try to go to and understand for yourself. Number one. Number two, when you want to learn more about healthcare, health policy, you want to make sure that you can join certain circles. Even on like Facebook, on social media, you can join certain groups, certain organizations, and get information regarding health policy. And so one book in particular that I always tell people to read is The Political Determinants of Health by David Dawes, Esquire. He's actually the director of the Satchel Institute at Morehouse Medical College. And so he actually talks about how policy is passed regarding healthcare. He breaks it down into letting people understand, making people understand how can you be a part of the health policy movement, and also making aware how can you do advocacy work. Advocacy is free. You don't have to, have a degree. You don't have to have a job in advocacy. You actually can go to an organization that talks about healthcare, and you can just be an ambassador for that particular organization. You can get access to health policy information. The congressional website is wide open. You can actually go and research health policy all up and down the congressional website, so you can keep abreast of what's going on. I know it's a lot of information that's being thrown out, but also if you really want to know about particular things, you can also research something, and you will have a lot of information regarding health policy. But health policy in general is talking about your access to healthcare, your access to insurance, understanding your insurance, health literacy. All those things are around how to get involved with health policy.
And that's a great note. Also, one of the things we want to work with the coalition specifically is a health committee. We have equality committee. We have an economics committee, but really that health committee, and we love for those of you who'd like to be a part of that to join in. But one of the things is the information is there sitting at the table. Is on the website for you to educate yourself, but also being a part of units that are dealing with those type of things to help you become more conscious. I would say when looking at the idea of legislation, all politics are local. All politics are local. So a lot of times we think that it's something that's supposed to come from the White House, but really it's something that comes from your house.
Exactly.
And so if it comes from your house, it'll reach the White House. That's the philosophy I use. You don't have to really. Most of the things that are affecting you happens in your council, your community, your city. Those are things that affect you, and then other things trickle roll downhill. So it's important for you to become engaged in what's happening in your community. Also, being a part of organizations, that are doing that type of work on presenting that type of information. Absolutely. So I'm going to ask Miss. She answered it so well. I don't even have to go back over it. We don't have to. We don't even have to answer that because she already got it. She got it. We don't even have to go on how to do the policy.
She covered it all.
We covered it all. We're moving forward. We're moving forward. She already covered it. She got it. What we want to talk about as well is what can you do to make your community conscious of these type of things. So one thing's either Miss Sylvia or Mrs. Passion, if you can share what can you do to make your community conscious or people conscious about healthcare and different issues.
So I know for me personally, being as though, like I said, birth work is kind of my niche. I currently have a business. It's called Passionate Beginnings, and I've had Passionate Beginnings for 5 years now, and I operate as a doula. And so I'm able to actually go and I'm hand in hand with these families, with these moms that are actually going to birth. And a big part of what I do is educating, not only educating these moms, but like Miss Candace talked about earlier, I use my platforms to kind of educate people on how to create a birth plan, what foods should you be eating. These are the type of changes you're going to see. This is what you should do to have a easier labor or a good labor per se. Oftentimes I hear my like just people in the community, the number one thing they complain about, my doctor's appointments are so quick. They don't answer my questions. I don't really know what's going on. I have so many thoughts, so many questions. And so with me being a doula, that gives me the opportunity to educate people, whether they're my clients or not. I'm able to kind of provide them with that information. And if I don't know the information, I'm able to outsource and provide the information as well. I'm currently in school now to become an international board certified lactation consultant, which is going to also help the community I serve, specifically the African American community, because where I'm located, we don't have any outpatient organizations that do or help moms with breastfeeding. So pretty much breastfeeding rates are already low for Black women. So after they leave that hospital and they start to have difficulties, there's nowhere for them to go. And so I hope to be able to have this organization and to be able to outsource, and they can come and I can help them and hopefully be able to increase those breastfeeding rates, because it's good for our people, not only for the moms, it's good for the babies as well. And so I think that the best thing to do is to just keep people educated, keep people informed. And I know for me, I like to let everybody know the pros and the cons. These are your options. And now I put it in the ball is in your court. Like, you choose which way you want to go. But you can't say like nobody didn't tell you. And that is so important.
Mothers and folks who are listening regionally, North Carolina, Virginia, South Carolina, please support her business. She's 25 years old and she's a doula. And a doula, you give birth through natural means, right?
Yes. Well, and that's the thing. That's a common misconception. So people think that doulas only support natural births, but I have been to C-sections. I've supported moms through unplanned C-sections, planned C-sections, natural births, medicated births. Recently over the weekend, I had a client who chose to do an unassisted birth, meaning they birthed at home on their own. So it was just me, mom, and dad. That was their method. I will say that now, due to COVID, a lot of people are kind of leaning more towards home birth. And it's a good option for people who don't have high risk births, so people who don't have any health concerns. And so I'm seeing more people kind of being afraid to actually birth in the hospital. But in my state particularly, there's a barrier because we don't have many midwives that are licensed to do home birth. In North Carolina, there's only one that's African American that's actually licensed to do home birth, and she's in Durham, which is about an hour and a half away from me. So many people that don't have transportation or maybe don't have the resources because currently they're not covered. She's not covered by certain insurance companies. It's a barrier.
Well, and I'm gonna say this: we're out of time, but we're not out of message. And so what we're gonna do is, if you all will consent, we want to do a part 2 to this at a later time to get really get down, because one of the words you mentioned, I mentioned Mrs. Smith and also Mrs. Willett mentioned is soon to be doctor. She about to be doctor soon. She about to be doctor. So soon I'll be calling Dr. Willett, doctor. So soon. But one thing you mentioned was insurance, and insurance through Obamacare has made it readily available for us, Affordable Health Care Act and all that. But also one of the things that's important for us to have insurance, period. Insurance, life insurance. Important for us to have insurance on medical insurance. The first thing I did when I got married was to get insurance, critical health insurance, to get insurance like life insurance, health insurance, serious injury insurance. Because one of the things, as a minister, as a minister and a pastor, I give you assurance. that's above. That's for above. But on earth, you need insurance, and that's for here. And so you need insurance, and I do believe you need assurance. And so I can give you one, but I can't give you both. so you need insurance. So one of the things when we come to part 2, I think that's something we can talk about is the options that are open to individuals and what persons can do who may be even eyesight and even vision and even just so many different things we want to get into, and also some things like policy. Soon to be Dr. Willa, I know she's on it. She's on it. And also, when it comes to the technical part, I didn't even know what a doula was until you mentioned it. I said, okay. I was just shaking my head. All right, I got you. All right. But we're looking for. Can we give just a minute of closing thoughts or closing remarks or closing comments that you would like to share with those who are listening on this CCC broadcast today?
Yes, so I challenge everyone to take charge, take back our power. It starts with us. We can't always kind of when nobody didn't tell me, nobody didn't show me. We have to take the initiative to do what's best for us, to do what's best for our children, to do what's best for our families. Whether it's changing our diets, whether it's changing our birth plan, whether it's you know changing how much we exercise. We have to take the power back.
Awesome. All right.
And I just want to say that I use this analogy all the time, when it comes to health. When you board a plane, they always say, put your mask on first before you can assist others.
Yeah.
So, you always have to make sure that you're good before you reach over and try to assist someone else. So you're your biggest advocate. Advocate for yourself when it comes to your health, like you do everything else, right? We advocate for everything else except our health. So we want to make sure that we are our number one advocate when it comes to health, and make sure that you get health literacy when it comes to your health care. And then also be your best self when it comes to health, because that is your best asset.
Awesome. Listen, you can't help anyone else until you first can help yourself. And so thank you so much for joining us on the CCC broadcast. We were delighted to have you with us. We're looking forward to part 2 discussion on health and the Black community, So we're going to chime off. Thank you so much. Hey, everyone. This is everyone. We want to thank you for joining us for the Coalition of Churches and Community USA broadcast. Listen, thank you. Go join us on the web, cccusa2020.org. And if you like the information that you heard, go to the home button, click on that button, go down to membership application, and become a member of the Coalition of Churches and Community USA. And if there are no branches in your area, you can start one. And in September 25th, we would love for you to meet us there on September 25th. Meet us in Washington, D.C., as we are planning to have in Washington, D.C., our CCC conference, September 25th. Mark your calendars, Saturday, September 25th. During this day, we're going to have the State of the Black Community. We're going to have a breakfast in the morning, and then we're going to have nonprofit workshops, a domestic violence workshop, and other interesting workshops that I think will be beneficial to you and also our community. Listen, we're not just talking about it, but we want to be about it. Go to cccusa2020.org and become a member. Go to the membership form, fill out your application, and we're looking forward to you being a part of this team. Listen, as we continue to advocate for equality, economics, and education, I'm sharing one more thing that we're doing on the economic front. We have a strategic partnership with Industrial Bank, and if you're going to be a member or get an account with Industrial Bank, tell them that the Coalition of Church and Community sent you, that you can come and be a part of that fellowship. We have a financial literacy workshop that's sponsored by Industrial Bank, one of the oldest African-American banks in the nation, and still sustained and still moving forward. And so those are some of the basic things. But listen, September 25th, we want to see you in Washington, D.C. All the information will be posted by May 1st, so you can book your hotel, so you can come on and join us for the CCC conference. It's going to be amazing. Hope to see you there, and look at our website, CCC USA 2020. God bless you. This is President L.K. Floyd, CCC. God bless.